Abandoned residents during the holiday season posed further issues for the already constrained Okeu and St. Jude hospitals, according to Health Minister Moses Jean-Baptiste. Jean-Baptiste, during his presentation at a December 2024 House sitting, claimed that individuals bring in loved ones under the guise of them needing care and then leave them behind, only to return days after to pick them up.
It's always a very challenging time for our health professionals. At the hospitals, the emergency department, Christmas is a very busy time. But I just want to encourage St. Lucians. It is something many of you don't know, Mr. Speaker, that during the Christmas season, and sometimes the nurse system, Minister, just leave that alone. But during the Christmas season, it is very unfortunate and sad that we see an increase in the number of patients who their relatives take them to the hospital and don't return for them until after Christmas. You may not believe this, Mr. Speaker, but at both the Okeu Hospital, at the St. Jude Hospital, we see a number of individuals who come with their either elderly relatives or sick relatives, and they come to the hospital with them seeking services, only to find when these people are ready to be discharged, they don't come back for them until late, maybe January or so on.
Jean-Baptiste alleges that patients living at the health facility are further exacerbating the bed shortage issue at the medical institutions. He pleaded with residents to refrain from such a practice as it delays care for patients in need.
I want to encourage St. Lucians. Christmas is a time we have to really care for each other. Let us try our very best not to leave these responsibilities to the hospitals, because what we are doing is we are placing pressure on the hospitals. We are occupying the beds that should be left for emergencies. A lot of that is happening, Mr. Speaker. We have a number of families who have had their relatives at the hospitals for years. No one is claiming them. A number of individuals are just living at the hospitals. And those kinds of things, we need to open up and speak about them so that we can relieve. When you hear about pressures at the hospital, there are no beds and so on. A number of the beds are occupied by what we call long stay patients, long stay individuals. They are individuals who are just living at the hospitals.
The government is currently working with social services to ease the pressure on the healthcare facilities.
Lè ou mène famille ou l'hôpital là pour service. Viens acheter famille ou souple. Parce que yo ka occupy ces couches l'hôpital là avec les nous emergency, nous passage une couche parce que là ni moun qui est l'hôpital là, yo ka couye long stay. Ça veut dire famille ou mène au l'hôpital là avec yo pas ka vie point yo. Docteur ka acheter qui laisse qui famille yo, tout le monde ka di yo pas connaître moun ça là. So those kinds of pressures, especially during the Christmas season, they force the doctors and the nurses and so on to do all kinds of things to accommodate.
The Philip J.P. administration has pledged to provide more financial resources to help clear debt at the main health facilities and procure supplies. The government has vowed to implement additional strategic plans, provide more personnel, and complete the St. Jude Hospital to improve the healthcare situation on the island. Gina Filippi, HTS News Force.